from height. Death due to fall from height are common in urban settings. In occupational setting, it is the most common type of accident. Builders, electricians, miners, painters are particularly at risk. It is also a major cause of person injury, especially for the children and elderly. Factors contributing to falls from height include faulty equipment such as ladders and scaffold structures, and human factors such as intoxication and inattention. The evaluation of injury alone during autopsy is not sufficient to assess whether the manner of death is a suicide, accident, or homicide. Finding at the scene of death and medical and psychiatric and social history and toxicological result of the victim, which also be taken into account to determine the manner of death. Investigation of the scene. Falls or jump from places where normally do not go are highly suspicious of suicide. Suicide notes are also indicative of a suicide fall. Dangerous workplace like a building site, most falls are usually accidental. Signs of a fight at the death scene always suggest homicide. Distance of the body from the jumping site can be used as an additional tool to determine the manner of death. In intentional jumps, distance to the jumping site is likely to be higher than the accidental falls. There are no established mathematical formula for computing distance from suprastructure to site of impact. Thus, the question of fall is pushed can be determined. CT reconstruction of the pattern of fall and animation of the 3D bony window image may help in understanding the mechanism of fall and impact. Psychiatric history. History of psychiatric illness is most frequently found in suicidal falls from height, which often includes depression, schizophrenia, substance abuse. Injury pattern. It is dependent on the part of the body that hits the ground first. Height of fall, ground composition, age, clothing, body weight, and physical condition of the victim in the form of a pre-existing medical condition. Example: osteoporosis or an enlarged spleen. External examination. Examination of the clothing can provide some clues about the nature of the fall from height. In a feet, first impact, longitudinal tear in the loin region of trousers may be due to inguinal stretching. Postmortem staining is worse due to loss of blood. In feet, first impact, longitudinal tear of the inguinal region may be seen. In feet, first impact, longitudinal tear of the inguinal region may be seen. Plantar injuries are injuries with open fracture of ankle joint or calcaneum are characteristic. Bruising in the perineal region is sometimes misinterpreted as a sign of sexual abuse prior to the fall. Palmar skin tears and open comminuted fracture of the wrist and knees are common in free fall, wherein the victim they have attempted to cushion the impact. Blunt injuries such as abrasion and hematoma at the site of impact, plantar impact are frequent finding. Depending upon the impact surface, the ground textures might be reflected as pattern injuries. Palmar injuries such as abrasion, rope burns resulting from the attempt of the victim to hold on an object to preventing a fall suggest a homicidal or an accidental fall, or a fresh wrist incision. Hesitational marks are indicative of suicidal intention. Internal examination. Severe injuries of the internal organs and the musculoskeleton can be found in all fatal fall from height. Head injuries, all type of brain hemorrhages, subarachnoid, subdural, epidural, intracerebral and brain condition as well. Fall from factors subject injury patterns, height, position, area, calcaneum on first impact, calcaneum. On severe disruption and complete or partial loss of brain structures may be seen. In head first impact, there is usually open comminuted skull fracture with additional facial bone fractures and externalization of the brain over wide areas, and rarely severe internal organ injuries. If feet first impact force transferred upward can result in a significant pelvic trauma, as well as a ring fracture of the skull as forces drive the spinal cord upward into the cranial cavity. Brainstem injuries such as a laceration, contusion, transection are frequent. Traumatic subarachnoid hemorrhage can be seen where there is no evidence of direct head trauma is present. Neck injuries. If neck injuries along with the subconjunctival hemorrhages are present, then possibility of strangulation prior to the fall should be considered. However, blunt force neck injuries directly related to fall are frequent. Mild to moderate hemorrhage in the subcutaneous and muscular layers. Thyroid hematoma along with a fracture of a hyoid node may be seen in fall more than 10 meter. Chest injuries. Thoracic cage injuries like abrasion and bruises of the chest wall and rib fracture are found in all fatal fall. Rib fracture are mostly bilateral. Multiple fracture of the whole thoracic cage, including the sternum and the thoracic spine, are found, and height of fall is more than 25 meters. Heart. Cardiac injuries are frequently seen in fatal fall from height. Pericardial tears are most common, occur in the right posterior part of the pericardium, tend to be a longitudinal orientation. Endocardial tears are more likely to be found in fall from greater height. Complete or incomplete transmural tear of the heart affect the right heart. Atrial posterior wall are more often than the left heart. Tear of the interatrial septum are more common than an interventricular septal tear. Tears of the interatrial septum are more common than interventricular septal tear. In fall from great height, heart can be completely or totally torn off from the great vessel, which usually results in immediate death. Thoracic blood vessels. Rupture of the thoracic aorta are common finding in free fall victim and are mostly located in the isthmus area aortic arch. The frequency of aortic rupture increases with increase of height of fall. Condition of the lungs may be found in almost in all fatal fall. With a greater fall height, pulmonary rupture or complete hilus rupture can be found. Penetrating rib fracture with associated pulmonary injuries are common. Diaphragmatic rupture is relatively rare. Abdominal injuries. Liver rupture are more commonly frequently in falls from height than other mechanism of blunt abdominal trauma. Right lobe of the liver is involved more than the left lobe. TAs are often irregular in nature, but have been shown to the almost parallel in many cases. Multiple splenic rupture is common. Rupture of bruises of the intestinal root are a common finding in greater falling height, but traumatic rupture of the esophagus, stomach, bowel are relatively rare due to their compliance and relative mobility within the abdominal cavity. Retroperitoneal organs. Rupture of the abdominal aorta, in contrast to thoracic aortic rupture, is relatively rare. Psoas muscle bleeding may result from inguinal stretching, especially in feet first impact. Renal injuries are seen rarely. Cause of death. Majority of the victims die instantaneously at the scene or within minutes. The cause of its polytrauma followed by head trauma and blood loss. In free fall victim who survive for a few hours, 2 days, head trauma is the most common cause of death. In victims who survive for few days, cause of death including septicemia, multiple organ failure, and pulmonary embolism. Medico-legal aspect. Question. So, medico-legal importance in fatal falls concerning the manner of death and the toxicology. The determination of manner of death is quite difficult in some cases, and it may remain undetermined even after complete autopsy. Most cases of a fatal fall from height are suicidal. Accidents may occur at work, domestic settings, and during recreational sports activity. Homicide is rare. There may be additional injuries that cannot be explained by the fatal alone, like defense or offensive injuries. However, injuries is inflicted prior to the fall might well be masked by the impact injury. Cases of custodial death where the detainee was later found below a high-rise building window. The allegation has always been that he was pushed by legal authorities, maintaining that person jumped when left unattended. Thank you.